In this episode, we explore the topic of trauma in dogs and how it can impact aggression. It's another topic I'm really glad to see being discussed more in the dog training community, as trauma can have a significant impact on how we approach helping dogs in need. Caroline Alupo joins me to discuss what trauma is, the similarities and differences between trauma in dogs and humans, and what we can do to help dogs that may have experienced trauma. Caroline specializes in aggression of various kinds and post-traumatic stress syndrome in dogs. She has a master's degree in ethology and is a certified dog behaviorist and dog trainer. Caroline co-founded the dog app Petly and is a speaker at universities and academic institutions across Sweden and beyond. And if you're enjoying the Bitey End of the Dog, you can support the podcast by going to aggressivedog.com, where there's a variety of resources to learn more about helping dogs with aggression issues, including the upcoming Aggression in Dogs Conference happening from October 11th to 13th, 2024 in Scottsdale, Arizona, with both in-person and online options. You can also learn more about the Aggression in Dogs Master Course, which is the most comprehensive course available anywhere in the world for learning how to work with and help dogs with aggression issues. I also have a wide variety of webinars, upcoming courses, videos, and articles, all from the foremost experts in training and behavior. We are your one-stop shop for all things related to aggression in dogs. Hey everyone, welcome back to the Bitey End of the Dog. This week I have a very special guest because we're going to be talking about post-traumatic stress disorder in dogs, PTSD, which is something we haven't really talked about on the show. So I'm excited to introduce Caroline Alupo. Welcome, Caroline.
Hi, Mike, and thank you for having me.
Yes, let's jump right into this topic because we have a lot of listeners, a very broad range of listeners, and some are deeply entrenched into this topic, and some may have just started hearing about it in dogs. So can you kind of define what PTSD is in dogs, just for general sake of defining this first for the discussion?
PTSD stands for post-traumatic stress disorder. So it's really an anxiety disorder that dogs can get after experience like a traumatic event. It could be really anything where the dog has feared for his or her life and developed fears that have gotten stuck. It's like they're stuck in this nightmare. They keep being reminded repeatedly of whatever they've experienced. And they've been changed after this incident to their core, really. And they can fear, the whole world, or just people or dogs, depending on what they've experienced. But in short, it's an anxiety disorder after a traumatic event.
And what are some of the signs that dogs experience? And we'll get more into that, I think, into the nuts and bolts and the details of it. But just some of the initial signs that a dog might have experienced that or has PTSD, or we would give that diagnosis to.
Common signs are hyper-vigilance and an increased arousal after this event, as well as trigger reactions. So these dogs, they associate different things, different stimuli as triggers related to the actual trauma event. And they'll be actively trying to avoid those triggers. They will really elicit fear or anger in the dog when the dog is subjected or experiences these triggers. So that's very common symptoms. And sometimes these dogs also have other secondary symptoms like gastrointestinal issues and sleep disturbances, etc., depression, for instance. So quite common to what a human with PTSD would experience.
Yeah. And in that regard, there's been some debate, and I've seen some conversations about, how can you assign a human disorder to dogs, and how do we know if dogs are truly experiencing that? So what's your argument for that?
I think it's a valid point. It really is. When I did my study, I took the DSM scale, the diagnostic tool for different mental health disorders in humans. And I looked at PTSD and I thought, how can we apply this to dogs? Can we even apply this to dogs? And I had quite a critical eye when I looked at this scale. And I tried to take out what diagnostic criteria we actually could use for dogs. And a few of them I had to take away, like nightmares or flashbacks, anything where I couldn't, I can't ask a dog, are you experiencing flashbacks, or are you seeing, scenes from the trauma event, or are you dreaming about the traumatic event? I can't ask a dog that. So all of that had to be taken away. But the interesting thing was that in each diagnostic category, there's like 4 different diagnostic categories for PTSD. And in each category on the human side, you don't have to actually have all the symptoms in each category to have PTSD. So when I took out the ones that we can't really apply to dogs, I still had enough to work with to use it as a diagnostic tool for dogs. But I think the criticism is valid, and it's important always to be very critical, but we mustn't forget that dogs and humans, our limbic system is very similar. I mean, dogs are sentient beings with a very complex emotional life. So to me, after, knowing dogs my whole life and working with troubled dogs for over 18 years, to me, it's obvious in a way that they as well can experience this kind of, difficult anxiety disorder as we can.
Yeah, and you make a really great point in your paper about translational studies and, when we're using animals to study for human behavior and diagnosing things, but we sometimes, for whatever reason, don't do it the other way around. But it totally makes sense, Why can't we take human studies and apply it to animals if we're doing the opposite? So, yeah. So I want to talk a little bit more about the diagnosis of PTSD in dogs. You mentioned some of the symptoms we should look for, but can we dive deeper into that? Things like the intrusion symptoms and avoidance. And can you talk more about what we should be looking for? Let's say it's a pet owner, a pet guardian, or a trainer, or consultant looking to assign this term to a dog.
Yeah, I think foremost, we have to have like a clear-cut incident, and we have to have a picture of the dog in sense of the dog's well-being, and a post picture of the dog, and this incident in the middle, something that has happened. And we can start by looking at that incident. Was it unpredictable for the dog? Could the dog have feared for his or her life, or feared for really bad injury? If so, we have a risk of PTSD. And then we also want to look at, was this dog a happy-go-lucky dog before this incident happened? And afterwards, do we have hyper-arousal or an increased vigilance? Do we have trigger reactions, fear responses, startle responses, for instance, stress-related behaviors, and an avoidance of triggers, both primary and secondary triggers that could be associated to this traumatic event? If all those things are there, then we can start to wonder, could this dog have PTSD? And that's all we can do. We can't really know. We don't have to chase and hunt down the diagnosis and the term PTSD, but we can always look that, this is a dog that we suspect have PTSD. There's no need to be 100% sure, because we cannot be 100% sure, of course, as we cannot ask the dog anything. So,
yeah. And so, in a sense, we're recognizing the dog is in real need of care for that particular incident, in a sense of helping them move forward, because we're seeing all these signs and symptoms. So, your point about not actually having to officially label it is also valid. And I think that's important to remember, because we often see dogs going through some difficult times. Although I will say, I think it's also probably helpful. Would you find this helpful for guardians to be able to assign a term, and it allows them to empathize more with their dogs if they maybe empathize to PTSD? Maybe they know somebody, or they've experienced it themselves, and they might, if they know their dog has the similar diagnosis, do you think that would help them empathize more or relate to their dog more?
I think it can go both ways. I think some people, when they realize, oh, my dog possibly has PTSD, they take the symptoms more seriously, and they understand, the Dr. Jekyll and Mr. Hyde tendencies, and, they see how, okay, my dog ticks all these boxes, and I truly understand, how severe this mental illness is for my dog, and that's a good thing. Some people open up and think about, medication as a help for the treatment plan, which they might not have considered without this kind of diagnosis. So I think that's, a good outcome. The backside is if a dog owner just lands in the PTSD diagnosis and lose, the actionability and loses its force to help this dog, and just kind of settles with, my dog is a PTSD dog. I can't do much about the situation we're in or the symptoms my dog is suffering from. And that's a shame. In that sense, I don't like the effect of the diagnosis.
Yeah, that's such an interesting point too, because it makes you realize just how powerful labels can be and how we have to be careful about them. Yeah. So I want to back up a little bit too. You were talking about primary and secondary triggers, and you have some very specific examples in your paper that talk about, what has happened to a dog that really had that traumatic effect on them. One of them attacked by a drunk man. And then suddenly now the dog is worried about drunk people, which makes sense. Are men making eye contact, loud voices in crowds as sort of secondary triggers. And another really interesting one, attacked by a wolf in the forest, right? So that is not very common, I'm sure, for most people listening in, but wolf-like dogs, the scent of the wolf forest, unfamiliar dogs. Another one was I think there was some harsh training with a prong collar that strung up by a prong collar at the groomers. And now, of course, the dog is concerned about prong collars, people in general, all collars, groomers being harshly grabbed, and things that, of course, surround the groomers, setting, clippers, brushes, tables. So I guess my question here is, we know of the incidents in these cases. So when somebody, let's say, recently adopted a dog and they're seeing these things, maybe the dog feeling out of character in a sense of the quote unquote average dog in a particular setting. Let's say getting into a car, for instance, and the dog really panics just getting into the car, or shows all of these symptoms you were talking about. Would we know the difference? Would we be able to say this dog has trauma because of some previous incident, or this dog has just never been in a car? Can we tell a difference, or do we always need to have a baseline of what that dog's behavior was like before a particular incident?
It's a good question. I mean, I work with a lot of rescue dogs that clearly have PTSD according to this diagnostic tool from my study, but we do not know what has caused the PTSD. We just know it's there. It's very obvious because of the secondary and the primary triggers and the avoidance and the hyper-vigilance and the arousal and the sleep disturbance and the gastrointestinal issues, etc., etc., and like a depressed kind of low state. But I also work with rescue dogs, like you say, Mike, that just are not used to going in a car or unfamiliar with a lot of different kind of people, men or kids or other dogs or cats, and they're just not, used to it. And most often with those dogs, we can see a high level of fright or a high level of aggression if they choose to, act out on their fright. But with some operant conditioning and with some training, we often see that, okay, the dog is helped, and slowly but surely the dog feels more safe and secure around cats or sheep or horses or whatever it is, or the car, for instance. And we see a progression without, a holistic plan to help the dog forward. We're just actually practicing the car and doing it below the threshold for stress. And we're giving the dog, the possibility to back out of the training situation and say, yes, please, I want to try some more. And we're just doing that slowly over time and see that the dog actually gets more secure and is able to go in the car again. Then we do not have PTSD. It was just an insecurity around the car and a fright around cars. So there's a big difference. And it's very obvious when you meet these dogs that it's not the same thing at all.
And most of it is based on the observations of what we're trying is not working. So I'd love to talk more about that in dogs that have experienced trauma, where the learning ability, for lack of a better description, is really impacted. So can you talk more about that? What's happening, with the resiliency and or not being able to adapt as we would like to the situation, or make the changes we're often used to seeing, like in that rescue dog that maybe has never been in a car versus one that maybe was in a car accident that was very traumatic, and how difficult it sometimes can be and why that happens.
Yeah, I can take an example. I met a dog the other day, a dog that when I just looked at the paper, before I actually met the dog, when the actual booking came in, I was like, this must be a PTS dog. It was a rescue dog that had been in a lot of different homes and had been really harshly handled. And when I met the dog, however, I was like, wow, this is not a PTSD dog. This dog is scared. It's got issues. It's got stress-related behaviors that we need to address, but there's no PTSD. That self-healing motor, that mechanism was completely intact. When we trigger trained, the dog chose to back out and do like a stress relief and chose to play to be able to move from kind of a hard feeling to a lighter one. And it was doing this on her own. She was like really working the therapy on her own. A PTSD dog doesn't do that. They need a lot of help to actually get that stress release and not bottle up or not shut down. So that's a huge difference, really. And the dogs that, say, for instance, the car drive, say a dog has been in a car accident, just trying to guide that dog closer to a car using a treat and just slowly, bit by bit, day by day, trying to get the dog to go closer to the car, that won't really help. It won't get us anywhere. And often with a PTS dog, the risk of re-traumatizing and the risk of overexposure, it's so easily done. So with that classical kind of, counter-conditional training, it's just too much for them. We won't reach our goal. So that's a big difference, really.
Yeah. So let's talk more about that. So when we are trying things that we typically would do for a dog that has not experienced it at the trauma level, what other changes can we do? Are we looking at medications? Do you work a lot in conjunction with veterinary behaviorists or veterinarians that can prescribe meds? Are there other things that we should be aware of with these dogs?
Yeah, I mean, the first thing I want to do is really map out all the triggers the dog has. Is it just the car? I mean, that to me sounds like, in this case, where there's been a car accident, sounds like a big primary trigger. That's not where I want to start the training. So I want to map out all the primary triggers, and I also want to map out the secondary triggers, which could be like, a car braking or the sound of a car rolling in the gravel or honking of the horn or somebody just grabbing the car keys. Those could be secondary triggers. And I want to start with those triggers. But before I even get to trigger training, I mean, that could be months down the line. I really want to look at, where is this dog here and today? It's like a person with PTSD that's been, burning the candle at both ends. There's no energy left. There's the sleep is disturbed and the nutrition and the food isn't really, passing through, and the nutritions aren't taken up as they should. So I just want to leave trigger training until I have a more balanced individual in front of me. So sleep is really important, regular and deep sleep, especially for these dogs. And I also want to look at the pillars of load, like how much is this dog exercised? How much is this dog trained? What is the chemical load and the emotional load? And how can we lower these pillars so we get a more, balanced dog? Some dogs I work with now, they get way too much exercise for being a PTSD dog. So we're burning the candle in both ends. So really just helping them settle and relax, get sleep, get good nutrition. And after that, and I spent quite a lot of time doing that, I want to help these dogs remember their, good old days, their fun times, and when they were happy-go-lucky and do things that makes them feel secure and courageous and safe. So I really coach my dog owners to do a lot of that before we even get to the trigger training. During that time, we want to make sure that the environment they live in is as trigger-free as possible, and that they have really clear routines, daily routines, so that the loss of predictability and the loss of control that happened in the trauma incident, we want to give that back to their dog. So they should wake up every morning and know exactly when they get fed, exactly when they get the bone, and exactly when they get to go for a walk and where they are taken for a walk. So, all the adventures and, we just reduce that completely, take that away. So their life needs to be very predictable, because these dogs, they wake up and they expect the sky to fall down on them every single second. And they're often, they often fear for their life on a daily basis. And one needs to understand that and help them feel secure, first of all, before trigger training can even, be on the agenda.
And you mentioned, a really important point, which is ensuring proper sleep, kind of really looking at things from a holistic level first. Get a good foundation to the house before we start building walls and picking out window dressings and things like that, which would be the equivalent of going out for that car ride again. And we need that foundation so the dog feels well. But sleep disturbances, GI issues, sometimes you might also get that chicken and egg kind of question, right? Yeah. Is it maybe there's something else going on from a GI standpoint that needs to be addressed that is impacting the dog's welfare and health, and it's not related to the trauma? Do you ever come up with that conundrum? And what do you do from there?
Yeah, absolutely. I mean, I am lucky to work with really great vets, because there is a going backwards and forwards all the time. What's caused by stress. We know autoimmune diseases can be caused by stress. We know cataract and UTIs can be caused by stress, and we have to really lay the puzzle out and see what is causing what here. And sometimes we have to test different treatment plans to see what has what effect here. So it's about going backwards and forwards all the time. I see the same with PTSD dogs that I suspect have pain in their body. Sometimes there's a body posture that will eventually, with time, cause them pain because they're crouching in their behinds, or they stood like a little upside down turned U, really scared position, and that will cause pain in the back. Or do they have a medical issue causing pain in the back? I mean, we really need to find that out first. But some of these dogs, when I meet them, they're super scared of humans and people and new people. And it's hard for them to just go to the vets. But this is all information we need to give to the dog owner as well, that, the optimal thing would be for a vet to do their evaluation of your dog, but doing it now will re-traumatize. So we'll have to do this in a month or two. And we have to start with, socialization and handling training, so your dog doesn't experience that vet visit in a way that would just give us a worse prognosis, really. So it's really tricky with some of these dogs, because there's so many factors affecting their well-being.
Absolutely. It sounds like the number one key to moving forward is patience, right?
Yeah.
Because it's all at the dog's pace, and what they're going to be willing, I guess, for lack of a better word, to do for that session or that day. Just backing up to the veterinary component, I know it might be slightly different in the UK, and it depends on where you are in the world, but in terms of behavior medication, do you find something common that's being prescribed for dogs that have this diagnosis, or we're looking at trauma?
Yeah, I do. And I think that it's on the rise, different kind of medications. I don't know what it's like in the US, but in Sweden, we have some medications that we use for, just to calm dogs, just stress dogs, really. But then there's some medications that we used for compulsory disorders and anxiety disorders. And those are mostly, human medications that we're trying on dogs, but most often they've been tested on dogs to be able to be cleared to be used for humans anyway. But Swedish vets are actually opening their eye to more substances, more types of medication than just your average, calming medication. So yeah, but it's tricky. Not all PTSD dogs are, the case that they're not the kind of cases that need medications, but the really complex cases most often do. Maybe not for life, but for a period of time when we do the trigger training. And patience, like you said, it's key. So I always tell my clients that there's no quick fixes. There never are with dogs, and especially not with PTSD dogs. So, I mean, get ready to at least spend 6 to 12 months focusing on this, and slowly, the slower it goes, the better it is, help to rehabilitate this dog. Mm-hmm. So that's important to know if you have this kind of a dog, that there's no quick fixes and you need to take it step by step. And the slower the rehabilitation process, the really more durable the results.
Yeah. It sounds like the structure is so important part of that patience process too, because that lends itself to changing a person's lifestyle too, and what their expectations are for the dog, because they might have aspirations. Okay, we used to go hiking all the time. We used to go to the park and enjoy the outdoors, but now you don't want to do that, meaning they're talking to their dog. And I think it might be difficult for some people to have such a profound shift in their daily routine with their dog. But again, it boils down to really recognizing that that dog needs that. It is a lifestyle change, but that dog needs that to progress forward or move back to possibly what they were doing before, right?
Yeah, yeah. And I think if you have a dog that's experienced something that have given them PTSD, I think what you have to come to terms with, which could be, a grief process, that your dog will never be the same again. It's all about treating it slowly and trying to get the dog to feel as good as it possibly can and to handle its triggers and trigger reactions. But we can't really go in and cure it or erase PTSD or erase the memories. So for some people, it's a grief process. This wasn't what I expected out of dog life. And now I have this dog that I can't hardly take for a walk, without him lunging and barking at other dogs, for instance. And yeah, that can be a hassle. And I think during these months of training, we want to improve the situation. But if that dog has been brutally attacked by another dog, we will never be able to erase that memory, of course.
Right, right. And you speak of one particular trigger there. Now, thinking of dogs as a species and what they might find foreign in the universe and other stimuli that maybe humans don't find foreign or normal to us. But what are some of the common stressors or triggers that actually you've seen are common causes of trauma?
Well, it all depends. Regarding triggers, it all depends on the incident, whatever they experience. So it could be anything from sounds to dogs to smells to people or some kind of just typical kind of people, men or kids or nightfall. It could be anything just related to that actual event that traumatized the dog. So it's a big variety.
Do you think there's anything more common to dogs? Like, for instance, fireworks are a good example of, humans are like, okay, fireworks, at least most humans can understand. They can be traumatizing to actually some humans, but, for dogs, would you say it's much more so often with dogs? So something like that, where there is something that is, you see commonly causing trauma in dogs. Maybe another one I can think of is being transported from one location, one country to another, and they're being put in a plane and they're stuck in a cargo cabin for hours and they're moved to this foreign environment. That can also, I've seen, have similar effects. So can you think of anything in that regard of common triggers or causes?
Yeah, if we want to look at common causes like events that can cause PTSD, we want to look at any kind of incident that is unpredictable for the dog, where the dog actually loses control. So being crated and put at the bottom of an aeroplane and flown across the world, that could be such an incident. Anywhere where the dog is worried or scared of, bodily harm or fear of its own life being threatened, those are incidents that could cause PTSD. And that could be anything. And I think it's quite interesting that sometimes it's that wolf attack or the fireworks or that big where 3 dogs came and, attacked this little dog. That's obvious for us in a sense. But I think we also need to remember for a really small puppy, it could be that vet that pinned the puppy down to the examination table when that puppy growled because he didn't want to take his first shot. To a human, that might seem, it wasn't that bad and the vet let him go. But to that puppy, that could be an incident of those characteristics, and that can cause PTSD. Or just, having a pet gate falling over a small puppy. That could be an incident with those characteristics causing PTSD. It doesn't have to be that huge car crash or, the big earthquake or these big, huge things. We have to see it out of the dog's perspective and age come in play. So it's a difference if there's an 6-7-year-old dog who is experienced and has had lots of positive experience of other dogs and humans, or if it's this little puppy that's a clean slate and doesn't know much and hasn't experienced a lot. And that really brings us into one trial learning, which I think is if we can just, anybody with a dog, with a puppy or a rescue, that clean slate kind of dog, if we can just understand that the first time a dog experienced something, be it fireworks or kids running around or that pet gate falling to the floor, if that's the first time they experience that, if that is overwhelming to them, if that's an overexposure, that risks setting fears and even PTSD, but fears and phobias as well. So we want to make sure to really rub out the risk of one trial learning, but by helping our dogs experience a lot of things in a mild exposure. So just that pet gate rattling a little bit, or hearing a low volume of fireworks on your phone or your computer, or watching dogs run around and play in a park without being in the midst of it, being a little part away and just sitting like a puppy sitting in his dog owner's lap and just watching this. All of those experiences rubs out the risk of one trial learning becoming, a traumatic event. So I think that's super, super important when you have a dog, especially a puppy, that we shouldn't just, protect them from everything. We should, on the other hand, expose them to a lot of things, but at a really low exposure, that we should always be below the threshold of stress, so we do not overexpose them.
So it sounds like there's a lot of great preventative measures we can take, especially in puppies. So I want to dive more into that, but I want to take a quick break to hear a word from our sponsors, and we'll be right back. If you're interested in hearing more about applicable and immediate steps you can use with your own dog, or in your cases, I have a subscription series called Help for Dogs with Aggression, which is an additional format to this podcast where I walk you through a variety of aggression issues. Some of the topics already in the episode library that you would receive immediate access to include territorial aggression, emotions and aggression, dog-to-dog resource guarding, dogs that bite when being pet or handled, aggression on leash, and a bunch more. These are solo shows where I take you step by step on how to work with each of these types of aggression. You'll find a little subscribe button on Apple Podcasts where the bitey end of the dog is listed, or a link in the show notes to subscribe using Supercast. Your support of the show is very much appreciated. And don't forget to join me for the 5th annual Aggression in Dogs Conference, either in person or online, from Scottsdale, Arizona, from October 11th to 13th, 2024. This year's lineup includes many incredible speakers, including Dr. Clive Wynn, Veronica Putel, and Gina Ferris, Sarah Rodriguez, and Jess Arachi, Emma Parsons, Sarah Colnice, Dr. Kelly Moffitt, Sam Freeman, Dr. Amy Cook, and many more. Head on over to aggressivedog.com and click on the conference tab to learn more about the exciting agenda on everything from advanced concepts in dog body language to working with aggression in shelter environments to genetic influences on behavior. Dr. Amy Cook is also going to be bringing her entertaining and energetic personality to the grand reception and cocktail party, which, by the way, will be live streamed as well as in person. And as usual, you'll find a wonderful, kind, caring, and supportive community at the conference, both in person and online. And I want to take a moment to thank one of our sponsors for the conference. As a family of world-class trainers, Fenzi Dog Sports Academy provides expert and accessible instruction for competitive dog sports using the most progressive training methods and positive reinforcement techniques. Through their online platform, students are able to access professional dog training no matter your location or pup's skill level. FDSA believes the bond between dog and human is a proud and life-changing partnership, and they will work with you to develop a respectful and kind relationship with your furry best friend. Check out FDSA at fenzidogsportsacademy.com. All right, we're back here with Caroline Alupo, and we've been talking about PTSD in dogs, and now we're going to get a little bit more into those preventative measures we were just chatting about before the break in puppies and gradually exposing them to the world and all these things that could be potential triggers or causes rather for trauma if they're exposed to it at a high level. And, I think that's also an interesting way to look at socialization and habituation and getting dogs used to the world. But sometimes we have varying degrees. We have people that might get overzealous. Oh my gosh, I got to take my puppy to 100 places in 100 days. And, those rules of like active, massive amounts of socialization, and others that are like, oh no, we have to protect our puppies and put them in a cocoon and they can't see anything or be exposed to any diseases or anything. So we got to find this middle ground. I think that's why I was asking the questions about, what are common causes for trauma in dogs, because we sometimes, again, don't recognize. We have to, as you put it so eloquently before, seeing things through the dog's eyes, right? And so what about, here's a little more kind of deeper dive question. the breeding that we've done or the selectiveness for certain traits in dogs, let's say more hypervigilance or more scanning from certain breeds, herding breeds that we've bred to or selected for particular characteristics. So do you see that? Like, can we dive into that a little bit about what to consider when we have a certain breed? Maybe it's a livestock guardian dog that's more aloof and suspicious of people approaching, and how that might play a role in trauma if they're more likely to be wired, so to speak, to do certain behaviors.
Yeah, I mean, their DNA is already telling them, be aware of everybody that's not your pack. So if they experience something with somebody outside of their pack that kind of feeds that reservation, then those behaviors and those actions that they could take towards people that they don't know will increase, I guess. But it's different. I mean, any dog, being a Saint Bernard or a German Shepherd or a Poodle, any dog experiencing harsh handling. I mean, the common denominator in my study was human beings, handling dogs very harshly and punishing them and really being violent towards dogs. And it really doesn't matter what breed you are. I mean, there's a huge risk of traumatization. But of course, if there's two sides to each coin, if one breed gets PTSD and the event included a human being, and the fear inside of this dog makes them flee or panic or crouch up, that's one response. But a dog, like you said, a stock guarding dog or a dog with more vigilance as a natural, that dog could become more aggressive instead of fleeing the situation. So we'd have different symptoms, I think, different responses to the same kind of stress.
Yes, yeah.
But having like the dog you explained there, those livestock guarding dogs, I have a dog now, that Benji, he's 1.5 years old, and he's a mix of 3 guarding dogs, herding dogs. And when he was a puppy, having this in mind, there's that middle ground, like you mentioned, Mike, that we don't want to give this puppy to anybody to handle because that might make him scared and wary of people. But at the same time, we want him to realize that people around him aren't frightening and then they won't, do him or us any harm. So finding that middle ground. And like with another breed that naturally are a bit wary of sounds, then we would want to practice that more with that kind of puppy and play a lot of different sounds and make a lot of different sounds and kind of also see where is just habituation enough? Where can the dog experience these sounds played on a computer or just rattling in the kitchen or whatever? And naturally, they'll just, become used to them. And what sounds will the dog not get used to? What sounds that we make or play will always make this dog shy away. And those we have to counter condition and make like a fun game out of, but start at an early age and make sure not to overdo it. It's that middle ground again, just to do it a little bit now and again. And when the dog goes into their natural fear periods, then I kind of pause all this kind of training and pick it up again afterwards. So to really set an individualized plan that suits that dog. And in that individualized plan, we have to look at what breed is it and what previous experiences does this dog have? And foremost, what is the dog telling us regarding his or her emotional life when the dog is, stood in a market or hears something or sees another dog? What's happening inside?
Yeah, and along those lines too, it had me thinking about the different, you mentioned different developmental stages, and they kind of, what are the impacts you see? Let's say it's a dog that has very minimal socialization, and then during a critical development, so let's say it's a puppy at 7 or 8 weeks, but they were, let's say, a singleton pup, and they see their, they get attacked by a dog, something really bad happens. How much of a profound effect do you think that has, not only during their critical developmental stages, but also there's already a current propensity for fear of the universe? For, again, another phrase that's very broad, but let's say the dog already has a tendency to be fearful of things, and it's during their critical. Do you see a significantly profound impact when they experience trauma at that age?
Yeah, I do. I mean, those ages are really critical, the fear phases. So during that time, I really want to, with my own dogs, I want to keep them safe and sound, and I do not really, go out out on longer adventures or put them in situations where I don't have control of what's happening around or what people are coming up to them or what dogs we meet. So I really do take them out of a lot of situations I cannot control during those fear phases. And then I pick it up again on the other side of them, because they learn fears and the fears are really cemented in them so easily during those phases.
Mm.
But I think the more work you've done before, I mean, before the first fear phase, most dogs are quite happy-go-lucky and curious, and they easily find their courage. So I remember my house, it was like, it looked a mess when I had a puppy the last time, because there was these gates on the floors and there was tin foil and there were all these, balance boards and different things. It was scattered all over the place for the puppy to kind of, run around and crash into, nothing being dangerous, but making a lot of sound and the surfaces being slippery, some of them, just to make the dog really safe and secure regardless of what's happening around. Having umbrellas, or asking my son to put a big helmet on and walk around and toss the dog some treats, vaccinating the dog from being scared of weird things, really. Early I played not only fireworks on the computer, through the speakers, but also babies, talking, cooing and giggling, because I have no babies in my house. My kids are older. So just getting them used to that kind of noise. So it's not a rarity, and we won't risk that one try learning of it becoming scary.
Yeah, and it had me thinking along the lines that even when we do that, though, it doesn't completely inoculate the dog to a traumatic episode, because, somebody in a helmet, your dog might be used to seeing people in helmets now, but somebody in that helmet could do something really bad to the dog eventually. And so it doesn't completely inoculate them, but it certainly adds a layer of protection, I guess, so to speak, of perceiving something for the first time, with all of those other components in the environment, right? So in this regard, we've talked about preventative measures, but let's talk about what we can do to help the dogs that have experienced, or we're putting this label of PTSD on. What can we do in more of if we're talking to the trainers and consultants that are listening in right now, what can we do to help these dogs? We mentioned very gradual exposure, going at the holistic level, gradually adding in the triggers that are not the direct context, I guess you can say. But you'd mentioned something very important too, is control and safety, the feeling of security and predictability. So can you dive more into that detail? So let's say we're combining counter conditioning with that control. What does that look like for you?
Yeah, this is a really good question. I think a lot of dog trainers get a bit stuck in, desensitization and habituation, but there's a risk, because what's happening actually when you work with habituation is that you're using extinction. And there's always a risk in that. And there's a big risk of overexposure. So I preferred really controlled trigger training with counter conditioning. And counter conditioning, I mean, it can sound like, okay, so you play the firework sound, you toss the dog a treat, and then you repeat that. But that's not it. That's not counter conditioning. So counter conditioning in this state is really having a very strict setup that the dog can predict foremost and can control. That's super important. Let's take an example. Let's say we're working with a dog whose primary triggers is sounds related to fireworks. So the setup would be the dog not in a sit-stay position, because some dogs, they just go into working mode and they don't connect with their heart. They mostly connect with their head and just want to be obedient because they want that treat or that toy. So I want to stay clear of any cues associated with kind of obedience training, or whatever you'd like to call it. So just a setup where the dog knows that if I stand in this spot or if I move to this place, then the training starts. So like a blanket or just a wait a minute sign, rather than a stop, stay cue that's been taught. Then I'll place out like an external reward, if it's a toy or if it's a treat. And I want my dog to focus on that. And then I'll always ask, are you ready? And if the dog looks at me or looks at the reward, the dog is saying, I'm ready to work. I want to do this. If the dog shies away or looks away or yawns, or it doesn't have to do much. It doesn't have to walk off the actual blanket or leave the stage. It could just in any way express, I'm not ready. That's when I just put my hands up and stop. And I'll still reward the dog with whatever I'd placed out there, an external reward. I'll still give the dog that reward, just to say you do not have to listen to the sound to get the reward. This is not, a situation where you have to listen to a sound to get food or get a treat, because that's not fair. So I'll reward the dog even if the dog says no to training. But if the dog says yes, looks at me or looks at the reward, then I want to start teaching the dog that this results in me playing a sound. And if I start with a fireworks sound, I'm not being very kind, I'm scaring the dog, even if it's at really low level. So I'll start with any other sound. I'll click my fingers, or I'll play a sound of a cat meowing or a duck quacking, just something so the dog hears a sound, and straight afterwards I always like to go bang. So instead of going go ahead or okay, I'll just go bang, and I'll let the dog run off and get the toy or get the treat, and we'll repeat this. And after a while, when I have like a dog that's really eager to practice, because this is a lot of fun, and the sounds aren't that bad, then I start really just adding some sounds that are similar to fireworks. They don't have to be fireworks, but they're just a similarity at a really low volume on my phone or in the speaker. And if this is tricky and the dog dislikes it, the next time I'll use one of those sounds, I'll have like the earbuds in the dog's ear. So I'll make the sound even less loud by putting earplugs in. And I'll make sure that if the noises that we work with are 20-30% the sounds that the dog doesn't like, the rest will be sounds that doesn't awake negative emotions in the dog. So I always want to have a good and positive balance there. And it's not about doing 38 repetitions. It might be 6 or 8 repetitions, and then we take a break. But that break isn't me talking to the client, not having focus on that dog. That break is always about, number one, stress release, going out, running, jumping, barking, playing tug of war, whatever the dog needs to release stress. And the second is helping the dog land again, to land softly. Maybe it's a treat search, or it's a massage, or it's holding the dog close. It's helping the dog unwind after the stress release. And after that, the dog is either placed back in the car or in another room, wherever the dog feels safe. So we have rest. And then I talk to the client. And after that, we'll go back on and do maybe 6, 8, 10 repetitions again before a break, depending on the dog. So it's less is more. And we have many of these sessions, and I teach the client how to do this at home. And this is like first phase training, and then it's phase 2 and 3 and 4 and 5. And when we reach phase 5, when it comes to sound training, that is when we leave, well, in phase 4, really, that's when we leave these sounds on a computer or on a phone or on a speaker, and we start making sounds that are similar to firework sounds. And after that, when we, really reinforce the cue bang, which means run towards your external reward when you've heard a sound, then in phase 5, we start using that bridge, that bang cue, in a lot of different situations that's just in your everyday life. Like the dog owner might be walking the dog and somebody shuts a car door, or shuts the lid of a trash can, and there's a noise, and the dog owner can say bang and toss out a reward or a treat. And we start really helping the dog understand that this training applies everywhere. It's not just a setup. When we go see Caro, it appears at home, it's on our walk, it's in our living room, it's everywhere. And it's also in this phase where if we've added medication, we want to start phasing out the medication to see will the results in the form of the dog feeling safe and secure and handling these kind of sounds when they are not predictable, so when the dog can't foresee them coming, if the results are still there, good, then we can keep phasing out the medication. If not, we have to keep the dog on medication, and we have to work more on sounds being unpredictable. Because that's the reality, in the beginning of the rehabilitation phase, we really want to give the dog control and predictability, but we can't just stay there, because then we won't help the dog reach a level of security that actually helps them in real life, where sounds will be unpredictable. That was a long answer to your question, Mike.
I love that it's a beautiful answer, because you really stress the need for choice and control as part of this program. It's so important that the dog can opt to say, I don't want to do this right now, but still get reinforcement for it. I just interviewed Ken Ramirez, and he was talking about this same concept with a beluga whale and teaching the beluga whale to say no. And I think it's such a powerful tool, because one of the side effects of this sort of training, as you mentioned, the extinguishing of a behavior can come with frustration, which then for a dog, one of the symptoms we were talking about refers that rage or anger that can be a side effect of this trauma or a trauma response. And we certainly don't want to see that, because this, again, is an aggression podcast, and we talk about aggression all the time. That's one of the things we often note. So it's such an important concept, I think, to include really in any of your training programs, but especially with dogs that have experienced trauma. I want to take a little deeper dive into the training aspects here. In your paper, you had explored some different training techniques and protocols that are used for these dogs. One of them being tattling. Now, tattling is not a common phrase in the US. So can you just explain what that looks like really quickly for the listeners?
Yeah, it's counter conditioning, really. But the dog is taught to look at the trigger or listen to the trigger. So say, for instance, the trigger is another dog. So I'm stood with the client and the client's dog, and I ask a decoy dog to come out. So if I'm tattling training, the client dog will look at the decoy dog and straight away will give a reward cue and reward the dog by our side. So the client dog will look at the decoy dog and turn around and look at us. And that's the tattling behavior, to look at the decoy and then turn and look at us. And we'll repeat this and reinforce this until our dog can look at the decoy dog, and without us praising or saying anything or giving the reward cue, the client dog will automatically spontaneously turn around towards us. And then we can give a reward cue and mark that turn, and then we really have that tattling, the turning away. What I also want to do with these dogs, because these dogs are scared, that's why they flee or they get aggressive, because they are really, really scared. So out of the dog's perspective, a scared dog in a dog pack is protected by the protectors, by the guard dogs. So after tattling, God, you opened up a can of worms here now, but after the client dog looking at the decoy dog and then turning towards me or the client, I want that reward to be placed behind us. So the dog that's scared looks at the decoy and goes in behind us, which gives us a chance to act as, the protector, to stand up and face the decoy dog and do so in a manner like a guard dog do. I always say to my clients, look like a Rottweiler, stand there, broad legged, focus on the decoy dog. So if your dog turns around, he or she can see that you actually got their back. You've got this covered. You're in the front line. You'll handle this. And that is super important for these dogs. I do another thing with dogs that are scared of other dogs or humans, that I teach them to sit slightly behind their owner, and the owner, puts their leg out in front of their dog. So their leg is like a barrier over their dog's chest. So they've actually placed themselves in the front line in front of their dog. And then either me or somebody else or somebody with a dog comes walking towards them. And the client, the dog owner, needs to look at their dog a little bit now and again, backwards and forwards, looking at whoever's coming towards them and at their own dog. And when they see that their dog is getting a little bit stressed out, then they'll put up a hand and say, no thanks, my dog doesn't want to greet, or just go away, or give me some distance, whatever. Just say something, but act. Put up that hand and act. And whoever was walking towards them need to quickly turn around and bolt off, as if they got really scared and was like, oof, I'm off. I'm not dealing with those two. And then we'll repeat this. And what we see after just 3 or 4 repetitions, this is super cool. The client's dog behind them, they'll stop lunging. They'll stop barking. They'll just look at their owner and go, okay, do your thing, scare them off. Because that's what we're teaching them. We're teaching them you're not on your own. Your human being will stand in front of you and will scare off whatever scares you. Because we have to meet these dogs where they are. We can't just, we have to have a strategy to help them feel less scared. But there and then, in the now, they are deadly scared. They're fearing for their life on a daily basis. So we need to become that protector. We need to be their Rottweiler and help them in the everyday situations that they meet.
There's so many ways we can unpack this too, because at the most basic level, we might just argue that, okay, it's the stimulus is the cue in the environment. So to return to the handler for reinforcement, sort of like an engage, disengage protocol or a look at that. But I do love the social learning aspect you put on it, in that your dog starts to learn, you're going to keep them safe. So you're advocating for the dog. And then we can also put the notion of the dog's got choice in the environment, so they can choose to flee, they could choose to lunge and bark, but we're just reinforcing for us humans the most desirable choice in the animal, which is returning to the handler and then going behind the handler as well. Yeah, it's really interesting for me to hear variations on this, and why for dogs with trauma, it's so important to have that additional element of that social learning where, okay, my person's got this. They're advocating for me, because it's a lot different than a dog that's not necessarily worried about their human advocating for them, or it's not, you don't get the same trauma response. So yeah, I love this. And I'd love to kind of also talk about the different protocols that you mentioned in your paper. Yeah, you had mentioned things like BAT, CAT, counter conditioning, tattling, and even punishment. So there was a couple of them that were most effective. And what were those?
The counter conditioning, which and tattling, which is, counter conditioning. There's just an operant part in it. And then it was BAT, of course, that had good effect. And punishment, of course, had the opposite effect. The dogs got worse or got re-traumatized.
You had cited some resources and some other papers in your study, but why do you think punishment is so detrimental, especially in these cases?
Well, it's just like a never-ending loop of harshness and violence, really. I mean, human or dog, if you've been subjected to violence and you have stress-related issues because of that, and somebody's trying to help you with them using more violence, it's just, pouring more petrol on that fire. It's never going to put that fire out. So to me, it's logical that more force will not help a dog in distress.
Yeah, and you think about the context too. If we're going to that same context where the dog experienced trauma, and then we add in something else to that context, when we're already trying to strip away these secondary triggers and work with each one of them, and suddenly we add something else that's another secondary trigger when you think about it in that context. At least that's the way my mind's wrapping around it. Like, why would we want to do that to the dog and add in something worse to an already bad situation, right?
Yeah, and I think the only reason why dog owners do that is because they lack the knowledge, that they don't know what to do. They're frustrated. They might have a dog that's really, fearful or has a high level of aggression, and they do not know what to do. So that's probably why people land in trying to use more force to solve aggression. But most often they realize quite quickly that it's only making things worse. I worked with a dog the other day that was really, really scared after harsh handling. It had so many homes, more homes than it had years on this earth. And it bit its owner when she tried to put the harness on or put the leash on, or it just went mad and just started biting everywhere, really. She said, I'm trying not to take this personal, but it really is, hurting my feelings and my hands, and I don't know what to do. And I said to her that she just needs to take her hands away at, when it's actually happened. Just slowly take your hands away and slowly walk away. and give the dog space. And then we set up like a training plan on how this dog gain control of putting on the harness herself and having, this again, are you ready cue and responding to that, and us never moving the harness on top of her, always her, sticking her head in the harness. And I said to her, the attacks that she does now, we use them to evaluate our training. So say she attacks your hand 3 times a day today. We want to practice and train in this manner and see, okay, in 4 or 5 days, how many attacks per day do we have? And in a week or 2 weeks, how many attacks per day do we have? So we're slowly getting down to 0. So some people just also have to understand that there and then the symptom, the attacking of the hands, it's not, we don't act there and then. That's not when we solve it. We solve it in different manners out of a holistic perspective, and we see those reactions like, a receipt. Is our training working or not? Are these attacks actually being minimized with the training, or are they increasing? And I think that's super important, always to evaluate whatever you're doing with a dog, trying to help a dog, always evaluate every measure.
I think that's a great way to wrap up this episode, and remembering the patients and really keeping an eye on things with our dogs and evaluating and meeting their needs and advocating for their needs. So thank you so much. This has been fascinating to chat with you. And I'd love to find out where listeners can find out more about you as well.
You can reach me on Instagram or on Facebook, either Caroline Alupo, or you can search for Petly, which is like a companion app for dog owners that I've helped create. So Petly, and you can also download Petly, on App Store or Google Play. But on Instagram and Facebook, you'll find me at Caroline Alupo.
Excellent. Caroline, thank you so much. I really appreciate you taking the time to chat with us, and I hope to see you again in the future. It was wonderful chatting with Caroline, and I hope you enjoyed this episode as much as I did. Learning about what trauma is and how it can impact dogs or humans can truly shape and help our behavior change strategies and ultimately create more empathy for those who may be struggling. And don't forget to head on over to aggressivedog.com for more information about helping dogs with aggression. From the Aggression in Dogs Master Course to webinars from world-renowned experts and even an annual conference, we have options for both pet pros and pet owners to learn more about aggression in dogs. We also have the Help for Dogs with Aggression bonus episodes that you can subscribe to. These are solo shows where I walk you through how to work with a variety of types of aggression, such as resource guarding, dog-to-dog aggression, territorial aggression, fear-based aggression, and much, much more. You can find a link to subscribe in the show notes or by hitting the subscribe button if you're listening in on Apple Podcasts. Thanks for listening in. As always, stay well, my friends.
Does that make any sense?
Totally. And I'm about to sneeze, so I'm going to have John edit this out. Give me 1 second.
All right.
Sorry.